Today we want to discuss about mood stabilizers, or what we can call anti-manic, or drugs used to treat bipolar. And as we begin, we remind you to subscribe if you haven't subscribed, so that you can always be notified whenever we release other videos. Like the video and share the comments. So today we are looking at drugs used to treat bipolar disorders, or what we are calling mood stabilizers. And bipolar means two-sided, or bipolar disorders. These are mood swings. They are episodes of mood swings. And these mood swings comprises of emotional highs. It has emotional highs and lows, and emotional lows. Whereby emotional highs, that is mania, then emotional lows, that is depression, which we shall not discuss in this video because there is a previous video on depression and different drugs used to treat depression. So today we are looking at how we can treat these bipolar or bipolar disorders. So this is a mental illness characterized by mood swings or episodes of emotional highs, whereby someone is hyper and in a small time they change the mood and they become depressed. That is what we can call bipolar disorders, whereby highs and lows. So according to this graph, we are going to see if this is the graph, if this is the stable. If this is the stable mood, you find someone with the bipolar at one moment it goes into what we call mania. This is where there is mania with emotional highs. Then after some time, they switch to emotional lows. So whereby this one is going to be bipolar 1. This is bipolar 1, and this one becomes bipolar 2. So this is emotional highs, then this is emotional lows, which is depression. So we shall find, and mania is categorized into two. We have mania, this is mania, and hypomania. So this red broken line stands for hypomania. Then this one we have depression. Below the mood, from this point, this is depression, and we have severe and moderate depression, whereby this is moderate depression, then this is severe. At this point, someone is under severe depression. And we saw that these bipolar disorders, they are due to overproduction. It is due to defect of the limbic system. And this limbic system, that's why we see if there is much production of dopamine or serotonin, or sometimes glutamate, it is the one that leads to these mood swings. So the major cause is due to increase the production of either serotonin, that is the 5-hydroxytryptamine, or dopamine neurotransmitter. That is also, we can put it under here. So after seeing these mood swings, how they come about, that is bipolar disorders, now we can look at the drugs used to treat these disorders. And the first line drug used currently is lithium, or you can call it lithium carbonate. And this lithium carbonate, its mechanism of action, it acts by inhibiting inositol. It inhibits inositol monophosphatase and inositol phosphatase. So these are two enzymes which are inhibited by lithium. How we know that if we have PIP2 during, this is G2, G-coupled receptor, that is G2, whereby when it is G2 we have PIP, which is converted to DAG, and IP3, that is inositol 45145 triphosphate. This is what we learned under signaling mechanism. And this increased IP is the one that increases release of neurotransmitters. So what happens? Lithium crosses the CNS and causes or suppresses regeneration of IP3 or regeneration of PIP. But majorly it inhibits regeneration of inositol. Because if we have PIP2 converted to DAG by phospholipase C and IP3, this one has 3 phosphates, then IP3 for recycling it can be reduced to IP2, then IP2 is reduced to IP1, and this IP1 is the one that regenerates inositol. This one is catalyzed by inositol phosphatase, then this is catalyzed by inositol monophosphate. So we are seeing lithium as a drug coming and inhibiting these two enzymes involved in conversion of IP2 and IP1, which are used for regenerating inositol during G2 signaling mechanism. And after inhibiting the regeneration of inositol, there is no production of neurotransmitters. That is, and the major aim is to decrease the production of neurotransmission. So that is what we can discuss under the mechanism of action of lithium. And the indication, we are using it in the treatment of mania and hypomania. And still, because of it, it has a half-life of 24 hours. Its half-life is 24 hours. So it can also be used in people with episodes or mixed pattern, whereby episodes, people have mania, at the same time someone has depression. We can use lithium. And the adverse reactions, the drug adverse reactions, or the side effects of lithium, this lithium, it causes, one of the side effects is hypothyroidism, whereby it inhibits production of TSH from the anterior pituitary gland. Another side effect, it causes diabetes insipidus, how by inhibiting production of antidiuretic hormone, and this leads to polyuria. This leads to polyuria and polydipsia, that is increased thirst. Polydipsia. Then another effect, this hypothyroidism can result into weight gain. And as if this is not enough, it also leads to leukocytosis. And leukocytosis is increased white blood cell count. This is lithium, and this lithium can also cause sedation, So it has many side effects. And another thing, it has a low therapeutic window, or it has a low therapeutic index. So meaning it must be monitored. Any overshoot in dose, it can result in too much toxicity, and it can be treated by, because of its low therapeutic index, it can be treated by diuresis. That is what we can say. So these are some of the side effects of lithium. So after looking at lithium and its side effects, of course, the ones we have left behind is like nausea, vomiting, tremors, hand tremors. Even here it can lead to tremors. So these are all the side effects of lithium. So lithium is always the first line drug of choice for treating bipolar. But in case someone is not responding, we can use an antiepileptic drug known as valproic acid. Valproic. This is the valproic acid, or you can call it valproate, sodium valproate. This is its other name. And its mechanism of action, this valproic acid, it acts by inhibiting glutamic acid decarboxylase. If we have glutamic acid, it is reduced to GABA, that is gamma aminobutyric acid, by glutamic acid decarboxylase, and this is the one that is inhibited by valproic acid. And when it enhances, if there is more production of GABA in the cleft, then it increases or enhances the inhibitory effect. GABA comes and binds to its receptors, hence increasing inhibitory effect of GABA. And another, so this is one mechanism whereby it inhibits GABA. It doesn't inhibit, it stimulates. It stimulates. This one, it is stimulated. After stimulating it, more GABA is formed to bind to its receptors to bring its inhibitory effect. And another mechanism of action, number 2, is by it also blocks or inhibits sodium and calcium gated, voltage gated channels, inhibiting propagation of the action potential, leading to inhibition of actions of these neurotransmitters. That is the mechanism of action of valproic acid. And indication, we can use it in treatment of people who have failed treatment of bipolar, and it can also be used as a prophylaxis. Can be used as a prophylaxis to maintain to prolong the onset of mood episodes. That is prophylactically. That is what we can use it for. And apart from this, it can also be used in epilepsy. So that is valproic acid. And one thing you want to have to know, this valproic acid, it has ability to inhibit cytochrome P450 isoenzymes, hence taken in combination with other drugs. Because these ones, the metabolic enzymes are inhibited, it can cause increased dosage in blood of other drugs. So it should not be, its drug interaction is by inhibiting cytochrome P450 isoenzymes. And the side effects, here we want to look at the major ADRs. The major side effects here, it can cause alopecia, alopecia, that is loss of hair, or what you call hair loss. So you can lose hair when you are on treatment with valproic acid. And another adverse reaction is it causes thrombocytopenia, that is low platelet count, decreased platelet count, thrombocytopenia, and another peculiar adverse effect, it can cause liver necrosis. It causes liver necrosis, especially in children below 2 years. It can cause irreversible liver necrosis in children below 2 years. So it is not good to be given in children. Then another drug is another antiepileptic drug, that is carbamazepine. This carbamazepine, also its mechanism of action is by inhibiting sodium voltage-gated channels. So it comes and inhibits sodium voltage-gated channels, and when they are inhibited, there is no neurotransmission. And another thing, it can act by enhancing production of GABA. And this carbamazepine is also indicated in treatment of these bipolar disorders. That is what, especially acute mania. This one is indicated in treatment of acute mania. And in case someone is not responding to lithium, combined with valproic acid, we can resort to carbamazepine. And even because lithium has more side effects, we prefer valproic acid, which has less adverse effects, and carbamazepine. And among the adverse reactions of carbamazepine when given, it can cause respiratory depression. It also has the adverse reactions. It can cause respiratory depression. It can lead to what we call aplastic anemia. It can lead to bone marrow failure, and bone marrow failure leads to aplastic anemia, whereby the bone marrow fails to produce more blood cells. And when you do a CBC, you find all cell lines are low. That is an aplastic anemia. It can cause dry mouth. It can cause constipation, and so forth. And so the peculiar ones is respiratory depression and aplastic anemia for carbamazepine. Then Lamotrigine is also an antiepileptic drug acting the same mechanism as carbamazepine by inhibiting the opening of sodium voltage-gated channels. And when they inhibit, how? They prolong inactivation. They prolong inactivation, or they prolong repolarization of this. That once sodium channels open, they make them to keep open. So they prolong inactivation so that they do not transmit an action potential. So this is what we can see with carbamazepine and lamotrigine, which are antiepileptic drugs prolonging inactivation of sodium-gated channels. Still, this lamotrigine is also indicated in depressed phase. It is used to treat the depressed phase of bipolar. Depressed phase of bipolar. And adverse reaction with lamotrigine, the peculiar ones, we see double vision, whereby when you are seeing objects, you see them one in two. One object, you see two of them. That is what we are calling double vision. And also uncoordinated body movement, that is ataxia. Uncoordinated movements, it can also cause tremors. That is the peculiar side effects apart from nausea, vomiting, conversions, and so forth. Then lastly, in this video, what we can discuss is also these atypical antipsychotics, or second generation. We call them second generation antipsychotics. And these second generation antipsychotics include risperidone. Risperidone is one of them. Olanzapine is one of them. Can be used. Clozapine is another one. We have quetiapine. We have another one. Aripiprazole. All these are second generation antipsychotics, and their mechanism of action is that these second generation antipsychotics, they act by inhibiting 5-hydroxytryptamine 2A receptors, and at a lesser extent dopamine 2. These ones may or may not, but majorly their affinity is on serotonin 2A receptors, and after inhibiting them, then they are able to treat these bipolar disorders. They are also used to treat bipolar disorders, including mania and hypomania. And the side effect is that they cause metabolic syndrome. So among the side effects of these drugs, they can lead to diabetes onset, new diabetes mellitus. They can lead to diabetes mellitus. They can lead to hyperlipidemia. They can lead, of course, this one can result into weight gain. So these are the peculiar side effects of atypical antipsychotics. Why are they preferred? Because they have less or no. They have less or no extrapyramidal syndromes, such as muscular dystonias, akathisia, and Parkinson's-like symptoms. They are less pronounced compared to the typical antipsychotics. So these are the drugs we can discuss under this session, where we have seen lithium being a drug of choice, but because of its much side effects, which we have seen hypothyroidism, diabetes insipidus, characterized by polyuria and polydipsia, leukocytosis, having even low therapeutic index, it has been replaced by valproic acid and carbamazepine, which has less side effects. And we have seen also we can use Lamotrigine, which is also an epileptic, and we have seen all these ones majorly. The 3, 2 to 4, they act by inhibiting sodium gated channels, hence prolonging inactivation. So then we have ended up with atypical antipsychotics, which act by binding to serotonin 2 receptor and at a lesser extent dopamine 2 receptors, then inhibiting release of these transmitters within the limbic system, and they have less extrapyramidal syndromes. And the side effects we have seen, diabetes mellitus is common with them, hyperlipidemias, and weight gain, and these are the examples of the drug. Thank you so much for listening from the beginning until the end. We are always proud of you. Thank you so much.